Have you ever noticed how some men over 60 radiate confidence, intimacy, and purpose, while others quietly lose them? Could it be that one overlooked part of a man's body holds the key to his vitality and pride? What if ignoring it didn't just affect your health, but slowly eroded your dignity and connection to life itself? I'm Dr. Mohit Kha, a urologist with over 30 years of experience, and today I'll share 5 science-backed, practical strategies designed specifically for men over 60 to protect not just sexual health, but overall vitality and self-respect. Stay until the end, because I'll reveal a surprising bonus tip most doctors never mention, one that could save you from a painful condition and change the way you age as a man. Let's begin with the first, and often misunderstood, aspect of maintaining penile health as you grow older: the importance of keeping it active. The truth is simple but often ignored. When you stop engaging your penis, your body begins to let go of its vitality. Staying sexually active, whether through intercourse or other means, isn't just helpful, it's essential for preserving function and overall health. In countless conversations with men in their 60s, 70s, and beyond, I've heard the same misconception repeated: that sexual vitality inevitably fades with age, and nothing can be done. This belief is not only wrong, but it can become a self-fulfilling prophecy, accelerating the decline they fear most. Just like your muscles, heart, or brain, your penis thrives on regular use to stay healthy. Prolonged inactivity reduces blood flow, weakens tissue elasticity, and in some cases leads to atrophy. This is not alarmism. It's basic medical fact. The medical term for this is penile disuse atrophy, a condition far more common than most men realize, yet entirely preventable. Sexual activity, whether through intercourse, masturbation, or other forms of stimulation, serves a purpose far beyond pleasure. It's an act of preservation, keeping tissues oxygenated, flexible, and functional. Think of it like stretching a muscle to prevent stiffness and weakness over time. Even if intercourse or solo activity isn't possible due to physical, emotional, or situational reasons, there are still effective ways to protect penile health. Medically approved vacuum erection devices can help maintain blood flow, while pelvic floor exercises like Kegels improve circulation and support erectile function. The key is avoiding long stretches of inactivity, because no matter your age, your body responds to consistent use with sustained function and vitality. Beyond the physical benefits, there's a deep psychological and emotional connection. For many men, sexual vitality is tied to identity, confidence, and masculinity. When this begins to fade, often from misinformation or neglect, it can erode self-esteem and a sense of self-worth. By making sexual activity a priority in ways that suit your current stage of life, you can preserve not only physical function, but also pride and dignity. This isn't about chasing the vigor of your 20s. It's about embracing the man you are now, with wisdom, experience, and value. I've seen men in their 70s and 80s reclaim control over their sexual health by taking this simple but powerful step. And often, it sparks positive changes in other areas: stronger confidence, deeper intimacy, and renewed motivation, creating a ripple effect that lifts overall well-being. Another often neglected yet increasingly vital aspect of penile care with age is proper hygiene. Maintaining excellent hygiene isn't just about cleanliness. It's a cornerstone of self-care that becomes more important over time. After more than 3 decades treating men, I've seen how poor penile hygiene is one of the most overlooked causes of preventable health problems. Many men come to my office with infections, chronic irritation, or even serious conditions like penile cancer, often because they were never taught how to adapt their care as they age. This isn't neglect, it's a matter of awareness. As the years pass, skin becomes thinner and more sensitive, while the immune system's ability to fight bacteria or heal irritation weakens. Hygiene habits that worked in your 30s or 40s may no longer be enough. For uncircumcised men, the need is even greater. The space beneath the foreskin can trap bacteria, sweat, and dead skin cells, creating an ideal environment for infections like balanitis, or, in severe cases, increasing the risk of penile cancer. In countries such as Brazil, where penile cancer rates are among the highest, poor hygiene is the main cause. The good news? The solution is simple yet powerful. Gently wash the penis daily with warm water and a mild, unscented soap, avoiding harsh products that can irritate sensitive skin. If uncircumcised, fully retract the foreskin to clean the glands and surrounding area, then rinse thoroughly to remove all soap residue. Just as important, dry the area completely since moisture trapped in skin folds can encourage bacterial or fungal growth. This routine is especially critical after sexual activity, as fluids, lubricants, or natural oils can upset the skin's balance. Beyond preventing disease, good hygiene often brings an added benefit. Men feel cleaner, more confident, and more in control of their bodies. That sense of self-assurance can be just as important as the physical health it protects. Self-perception is powerful, especially in a world that often sidelines older men, subtly suggesting they let go of caring for their bodies. Treating penile hygiene with the same commitment as dental care or heart health reinforces both agency and self-respect. Now, let's address a rarely discussed yet equally critical topic: the risks of sexual activity when not fully prepared. Engaging in intercourse with a semi-erect penis is a hidden danger many men unknowingly face, often with lasting consequences. In my practice, I've seen countless men suffer injuries during intimacy simply because they didn't realize the hazards of proceeding without a full erection. It may seem like a minor oversight in the heat of the moment, but this habit can cause cumulative damage that affects both function and quality of life. The penis is a delicate structure, made up of fine blood vessels, spongy erectile tissue, and smooth muscle. Without full rigidity, it can't handle the mechanical stress of penetration. This can result in microtraumas, tiny internal injuries that may go unnoticed at first but build over time, leading to scar tissue. Such scarring can cause the tissue to harden and contract, potentially resulting in Peyronie's disease, a painful curvature that can make intercourse difficult or even impossible. Too often, men delay seeking help out of embarrassment, only to discover that early treatment could have minimized the damage. The solution is simple: be patient and prepare. Ensure full erection before penetration, through foreplay, lubricants, or medically prescribed aids if necessary. Open, honest communication with your partner about pacing can prevent injury and protect long-term sexual health. The goal here isn't about treating yourself as fragile. It's about empowering yourself with the knowledge to safeguard your long-term health and enjoyment. Now, let's confront a modern challenge that affects not only physical well-being, but also emotional and relational health: the over-reliance on pornography. With today's easy access to adult content, many men, especially those facing loneliness, widowhood, or a sense of disconnection, turn to it as a harmless escape. But excessive use can quietly undermine real-world intimacy and desire. Pornography trains the brain to respond to highly specific and often unrealistic stimuli. Over time, this can dull natural arousal, leaving some men frustrated when real-life intimacy no longer produces the same excitement. I've seen men in their 60s and 70s misinterpret this as a physical problem, when in reality, their arousal pathways had been reshaped by constant exposure to porn. Reducing consumption and focusing on authentic connection through shared intimacy, emotional bonding, or even mindful self-exploration can help restore balance and satisfaction. The truth is, many sexual health challenges in later life aren't purely physical, they're psychological. When pornography becomes a habitual escape, the brain adapts to expect hyperstimulation. This makes it harder to respond to natural cues and can create a sense of dependency that feels like a trap. Beyond the physical effects, The emotional toll is profound. Shame, guilt, and inadequacy often creep in when private habits begin replacing genuine connection. The secrecy can lead to isolation, as men withdraw from partners or avoid social situations out of fear of judgment. Over time, this erodes self-worth, leaving men to question their masculinity, their ability to form meaningful bonds, and even their value as partners. The emotional side of aging can be complex, especially when society's expectations about performance and vitality already weigh heavily. I've spoken with men in their 60s who describe feeling disconnected, not only from their partners, but from themselves. They find themselves in a cycle of seeking quick gratification through pornography, only to feel emptier afterward. This isn't a moral weakness, it's a human reaction to a culture that offers instant stimulation at every turn. Unfortunately, this cycle can intensify other challenges of aging, retirement, shifting family roles, and changes in physical health. The answer is moderation, not shame. Pornography is a part of modern life, and this isn't about demanding complete abstinence or criticizing personal choices. The key is intentional use, seeing it as an occasional supplement, not a replacement for real intimacy. The aim is to restore your natural arousal pathways, those fueled by memory, imagination, and emotional closeness. This may mean rediscovering what excites you without a screen, investing more time in foreplay, where touch, conversation, and anticipation build desire naturally. It might involve open, honest discussions with your partner about needs and desires, even if those talks feel uncomfortable at first. Or it could simply be giving yourself permission to feel desire without pressure to perform or match some unrealistic standard. Aging doesn't erase desire, it reshapes it, asking for patience and presence instead of instant results. One patient told me how he and his wife rekindled intimacy by setting aside home date nights just to talk, laugh, and share touch without expecting sex. Over time, that rebuilt both their emotional bond and physical closeness, reducing their reliance on pornography. Small, deliberate steps like these can give you back a sense of control over your sexual health, reminding you that desire is a living, evolving force, one that thrives with care and intention. Reclaiming pleasure through mind-body harmony isn't about losing something. It's about getting it back in a way that feels genuine and lasting. Excessive pornography often prioritizes raw stimulation over connection, leaving your mind and body out of sync. By stepping away from that cycle, you make room for a richer, more integrated experience of pleasure, one that respects both your physical needs and your emotional well-being. This balance matters because sexual health isn't only about what happens in the bedroom. It's reflected in how you feel in your body and mind every single day. When shame or disconnection creeps in, it shows in your confidence, your relationships, and your overall vitality. But when you nurture real connection, whether with a partner, yourself, or even your imagination, you begin to feel whole again. This is the true foundation of sexual health, and it naturally leads to the next essential factor, lifestyle. After decades of working with men over 60, I can tell you without hesitation, lifestyle is the most powerful driver of sexual health, far beyond any pill or prescription. Many come to me hoping for a quick fix, a magic solution to restore the vigor they think they've lost. I understand the appeal. A pill feels immediate and promising. But no medication can compete with the transformative impact of consistent, healthy habits. Your lifestyle fuels every system in your body, from cardiovascular health to hormone balance to mental clarity. Sexual function, in particular, depends heavily on these systems. Erections rely on strong blood flow, which is only possible with a healthy heart and blood vessels. When habits like smoking, heavy drinking, or eating processed foods take over, you're not just damaging your heart, you're also reducing circulation to vital areas, including your penis. In fact, erectile dysfunction is often one of the earliest warning signs of cardiovascular trouble, sometimes appearing years before a heart attack. Erectile dysfunction can sometimes be your body's way of signaling that something deeper needs attention. I once treated a 62-year-old man who came in frustrated about his ED, only to discover through testing that he had early-stage heart disease. By quitting smoking, adopting a Mediterranean-style diet, and committing to a daily walking routine, he not only restored his erections, but also lowered his risk of a heart attack. His story is a powerful reminder. Sexual health is often a window into your overall vitality. The encouraging truth is that every healthy choice you make brings both immediate and lasting benefits. Quit smoking, and your blood vessels begin to heal within days, improving circulation throughout your body. Cut back on alcohol, and you can help rebalance testosterone levels, which often decline with age and heavy drinking. Even simple habits, like walking 30 minutes a day or eating nutrient-rich foods such as blueberries, spinach, and salmon, can strengthen vascular health and boost your energy. These changes aren't just about slowing decline, they're about enhancing your quality of life. I've had patients tell me how a daily morning walk with their dog not only improved stamina, but also renewed their sense of purpose. They slept better, felt less anxious, and noticed their libido returning naturally. This is the ripple effect of good habits, proof that lifestyle is not a punishment, but an investment in feeling like yourself again. What inspires me most is watching men realize their bodies aren't broken. The body is remarkably responsive, ready to adapt to the care you give it. I've seen transformations sparked by small, sustainable changes, swapping soda for water, prioritizing quality sleep, or reconnecting with hobbies that bring genuine joy. Over time, they stop relying on pills because they've built something stronger, a foundation of habits that supports long-term health, vitality, and confidence. Supporting sexual health ultimately supports your overall well-being. And let me be clear, this is not about judgment. Pornography is part of modern life, and I'm not here to promote abstinence or shame anyone for their choices. What I encourage is intentional moderation. If you choose to include pornography in your life, use it sparingly, as a supplement, not a substitute, for genuine human connection. The goal is to restore your natural arousal pathways, the ones sparked by memory, imagination, or emotional closeness with a partner. This might mean rediscovering what excites you without relying on a screen. It could involve investing more time in foreplay, where touch, conversation, and anticipation naturally build desire. It might mean having open, honest conversations with your partner about your needs, even if those talks feel vulnerable at first. Or it could simply mean giving yourself permission to experience desire without pressure to perform or meet unrealistic expectations. Aging doesn't erase desire, it refines it, calling for patience and presence rather than instant gratification. I recall one patient who shared how he and his wife rekindled their intimacy by setting aside regular date nights at home. They focused on talking, laughing, and physical affection without expecting sex. Over time, this strengthened both their emotional and physical bond, reducing their reliance on pornography. Small, intentional steps like these can help you reclaim control over your sexual health, reminding you that desire is a dynamic force, one that grows when cared for. Limiting pornography isn't about giving up pleasure. It's about reclaiming it in a way that feels authentic and sustainable. Excessive use often focuses on stimulation rather than connection, leaving mind and body out of sync. By breaking this cycle, you make room for a deeper, more integrated experience of pleasure, one that honors your physical needs and your emotional well-being. This balance is essential because sexual health is never just about what happens in the bedroom. It's about how you feel in your body and mind every single day. When you're stuck in a cycle of shame or disconnection, it affects more than just your private life. It seeps into your confidence, relationships, and overall vitality. But when you prioritize genuine connection, whether with a partner, yourself, or even through imagination, you begin to feel whole again. This is the true foundation of sexual health, And it naturally leads us to another crucial factor: lifestyle. If there's one lesson I've learned after decades of working with men over 60, it's that lifestyle is a far more powerful driver of sexual health than any pill or prescription. Many patients arrive hoping for a quick fix, a magic solution to restore the vigor they believe they've lost. I understand the temptation. Pills are immediate, tangible, and promise quick results. But no medication can match the transformative power of consistent, healthy habits. Your lifestyle fuels every aspect of your health, from cardiovascular function and hormone balance to mental clarity. Sexual performance, in particular, depends heavily on these systems. Erections rely on strong blood flow, which means the health of your heart and blood vessels is critical. Habits like smoking, heavy drinking, or eating a diet loaded with processed foods don't just harm your heart. They also restrict circulation to vital areas, including the penis. Erectile dysfunction is often an early warning sign of cardiovascular trouble, sometimes appearing years before a heart attack or stroke. It's your body's way of telling you something deeper needs attention. I recall one 62-year-old patient who came in frustrated about ED, only to discover he had early-stage heart disease. By quitting smoking, adopting a Mediterranean-style diet, and committing to daily walks, he not only restored his erections, but also reduced his heart attack risk. His story is a clear reminder: sexual health is a window into your overall vitality. The good news is that every healthy choice you make delivers both immediate and lasting benefits. Quit smoking, and within days, your blood vessels start to heal, boosting circulation throughout your body. Reduce alcohol, and you may restore balance to testosterone levels, which often drop with age and heavy drinking. Even small steps, like a 30-minute daily walk or adding nutrient-rich foods, such as blueberries, spinach, or salmon, can strengthen your vascular health and increase energy. These changes aren't just about preventing decline, they enrich your life. I've seen patients become more vibrant, confident, and engaged simply by embracing healthier routines. One man in his late 60s told me his morning walks with his dog not only improved his stamina, but gave him a renewed sense of purpose. He slept better, felt calmer, and even noticed his libido returning naturally. Lifestyle isn't a punishment, it's an investment in feeling like yourself again. What's most rewarding is watching men realize their bodies aren't broken, they're responsive. With small, sustainable changes, such as swapping soda for water, prioritizing rest, or reviving hobbies that bring joy, they often find they no longer rely on pills. Instead, they've built a foundation that supports not just sexual health, but their entire well-being. And sometimes the changes are surprisingly simple. Take, for example, a lesser-known habit, sleeping without underwear. At first, it may seem unimportant, but years of observation have shown me that even the smallest adjustments can bring significant results. Choosing to sleep without underwear, or at least in loose-fitting boxers, can actually support the body's natural repair processes during the night, especially when it comes to sexual health. These nighttime erections, known as nocturnal penile tumescence, aren't random. They're essential for keeping erectile tissue healthy by maintaining oxygenation and steady blood flow. But tight underwear or restrictive sleepwear can compress the penis during these episodes, causing irritation or reducing circulation. Over time, this constant pressure may even contribute to internal scarring, leading to Peyronie's disease, a condition marked by painful curvature that affects many older men. Sleeping nude or in loose-fitting clothing allows your body to function as it was designed. This simple change minimizes friction, supports comfort, and promotes long-term function. One 65-year-old retiree I treated was skeptical at first, but after a few months of sleeping without underwear, he noticed less discomfort during erections and a greater sense of ease in his body. Sometimes, the smallest adjustments deliver the biggest benefits, especially when combined with other healthy habits. All of these strategies, moderating pornography, prioritizing lifestyle, and even adjusting sleepwear, are more than just medical recommendations. They are acts of self-respect that strengthen your dignity, vitality, and connection to yourself. Sexual health is inseparable from overall well-being. When you care for your body, you don't just enhance performance, you reclaim confidence, presence, and joy. I've seen countless men regain this confidence, not by chasing youth, but by embracing their current stage of life with purpose. They walk taller, smile more, and reconnect with partners or loved ones in ways they thought were gone forever. If you've been struggling in silence, know this: you're not alone, and it's never too late to begin. Each day is an opportunity to make a better choice, whether it's taking a walk, choosing a healthier meal, or opening up to your partner. Remember, your health shapes your life, but it never defines your worth. Caring for yourself in these simple yet powerful ways sends a clear message to your body and to the world that you are present, vital, and deserving of feeling your best. Thank you for spending this time with me, Dr. Moit Ka, as we've explored how to protect not just your sexual health, but also your confidence, dignity, and overall vitality as you age. I trust that these 5 science-backed strategies, along with the surprising bonus tip, have given you practical tools to take control of your well-being and truly age on your own terms. Now, I'd love to hear from you. What's the one key lesson you're taking away today? Maybe it's the importance of staying active, the power of proper hygiene, or perhaps the simple yet surprising habit of sleeping without underwear. Whatever it is, commit to putting it into practice, and share it in the comments below. Your insight might be the encouragement someone else needs to take that first step. If this video has been helpful, please give it a like, share it with someone who would benefit, and subscribe to our YouTube channel for more practical health tips to help you live stronger, healthier, and prouder. Wishing you good health, happiness, and peace. And remember to subscribe to Healthy Aging Blueprint.